Hi there.
Dr. Stevens.
Yes, how are you doing, Marshall?
Hey.
Good to see you.
Thanks for bringing me in for this.
You're welcome, you're welcome. So what brings you in?
Well, I've been a little concerned with hair loss, which for me is kind of silly. One might think is I have so much hair.
Yeah, you look like a lion.
But I'm definitely losing my front area here, and the crown is getting really thin.
Okay.
So I have an abundance around the side. I don't want to do a comb over kind of.
No, that's not a good look.
No, it's not me. So what can you do for me?
So let me ask you a few questions. Are you taking any medications now for your hair loss, or putting anything on like Rogaine or
Nothing.
Propecia or Viviscal?
Nothing.
Okay, nothing at all.
Absolutely
And
nothing.
when did you first notice the hair loss?
Oh, it's been gradual for a decade.
Okay.
So it's been a long time coming. It's nothing catastrophic, but since I've always worn my hair kind of big, being in music and arts and stuff like that, I'd like to kind of keep my trademark, my freak flag.
Okay, that's fine. You've got a mane going. So have you heard about NeoGraft?
I've heard the name, but I don't really know what it's all about.
Okay, we've all seen hair plugs before. You've seen those Barbie doll hair plugs. They look terrible, right?
It looks like a toothbrush.
Yeah, well, or worse. Well, we don't do that anymore. And we used to take strips of scalp and then cut the little hair follicles and put them in, but then that left a scar here, and you've probably seen people.
It's gruesome.
It's terrible. And it takes a week to recover at least. There's numbness, and there's pain, and there's bleeding, and there's oftentimes a little strip of baldness there that people can't camouflage if they wear their hair at all
What's not
short.
to like?
Yeah, well, it was an improvement, but since then we've got something much better, and that's called NeoGraft. And with NeoGraft, we take individual hair follicles out one by one. The NeoGraft machine actually extracts these hair follicles from back here, where your hair is thick, and then we keep them over on the side, and then we put them in one by one where your hair is thin or where you're bald. And there's no donor defect, if you will. Donor meaning where we take the hair follicles. There's no problem there. You can go to work the next day if you want. Most people take a day off or so, but you could do it under local anesthesia and just drive yourself home.
Oh, great.
You don't have to go to sleep. You don't need any stitches. There's no scarring. So I do two things. I examine the donor to make sure you have enough hair there, and most people do. Then we look at where you need it, or the recipient site. Now some guys are as bald as can be up here. You are not. Most guys are closer to you, but some guys come in, they have no hair here, and we can fix them, but it takes 2 or 3 sessions sometimes because we can only do so many at a time.
At a sitting.
May I examine you?
Oh, please, yeah.
Okay, put your head forward. Okay, so you have very, very thick hair back here, and that's normal. Now put your head back. So your donor site, if you will, is perfect.
Oh, good.
Now the area up here on your crown is very thin, and does this bother you here?
Yes.
Okay, now let's look at your widow's peak. So you have a receding hairline and this widow's peak here.
Which is getting thinner. Lately,
Thinner, and it's going back,
yeah.
right? Right. So what we would do is we'd put in hair here to fill in this widow's peak. It wouldn't be a straight line because that looks stupid, because everyone has a little bit of widow's peak, but we'd fill it in right here and right here, and then do a lot right here on the crown. Okay, so you could easily absorb 1,500 to even as many as 2,000 grafts.
Okay.
Okay, so
Yeah.
we put the follicle in, and what happens is the little tuft of hair falls off. It falls out, and that's normal in the first month. Couple of weeks it falls out, and then about a month it's dormant, doesn't do anything, and then it starts growing, just like your beard grows, and it starts coming out just like your beard, and it grows a little bit every day, and over 3 months or so it gets to be about a ½ an inch long, and by 6 months it's, you know, at least an inch, sometimes 1.5 inches or 2 inches, depending on how fast your hair grows.
And it's permanent?
It's permanent.